Thank you, Meg, Maria, and Reverend Nicholas. Now we turn to two individuals who are passionate about self-measured blood pressure and improving cardiovascular health. You probably know Janet Wright as the first executive director of Million Hearts, or perhaps as the senior scientific advisor to the Surgeon General of the United States, or as senior vice president of the American College of Cardiology, or the current acting director of CDC's Division of Heart Disease and Stroke Prevention. Maria Prince is medical director at Aetna. She has served as the flight surgeon in the U.S. Air Force and as medical director for chronic disease prevention in Maryland's Department of Health and Mental Hygiene. Doctors Wright and Prince.
Hello, Maria. It's so wonderful to reconnect with you.
I know, it's so great to see you after 10 years.
We have been in the salt mines of hypertension control and really self-measured blood pressure monitoring for, like you said, a decade. I want you to share with our audience today what Aetna has done to help more people get access to and learn to use the evidence-based approach to blood pressure control, which is SMBP.
Sure. When I came to Aetna 5 years ago, I was absolutely thrilled that our clinical policy folks were on board with the U.S. Preventive Services Task Force recommendation for self-monitored blood pressure. I didn't have to make any big detailed evidence-based with a return on investment. They simply looked at the clinical guidelines and it was a no-brainer, is what they told me. So we were able to incorporate that into our clinical policy to support coverage of home blood pressure cuffs for the diagnosis of hypertension. And then later on, we subsequently added it for the management of hypertension. And that policy applies to commercial members, so members in private insurance, as well as members in Medicare through their over-the-counter benefit.
It's fantastic. And I know that it wasn't exactly pushing on an open door, but what I hear you say is that they followed the science, they followed the evidence. And that's what I think is, right. It's the strongest foundation. It's certainly what CDC believes in doing, is letting the science lead. And the policy has followed. That is a huge hurdle for Aetna members. And I think one thing you and I would advocate for is that all payers, commercial and public, follow suit, right? Follow the evidence and broaden that coverage. But with that accomplishment, there are still additional hurdles to overcome. Could you speak to those and think in terms of our National Forum members and how they might play a role?
Sure, absolutely. I think this is important for every one of you who might be listening to this. I've been lurking on this National Forum meeting for more than 10 years since I was a resident. And I've been in different settings, public health, primary care, and now with an insurance company. And I know that there's a role for each of you, no matter where you might be. So, now that we've had this coverage, I know that not every clinician is even aware that we have this coverage. So we appreciate your assistance in letting clinicians know about it and also letting payers know about it, because we've found that clinicians, obviously, we can't remember everyone's policy. So let's make it a no-brainer for them and make sure everyone has this policy. There should be coverage for self-monitoring of blood pressures, no matter if you're in private insurance, government-sponsored Medicare, or Medicaid. And I personally took that next step by reaching out to my Medicaid colleagues to make sure that their coverage policies were looking at home blood pressure monitors as well. And the other group that we're trying to reach are our patients, our members. So we're doing some really unique omni-channel marketing to outreach our patients so that they're aware of this coverage. And then every time I meet with a plan sponsor, that's another opportunity I have to talk with employers. I'm always reminding them of our unique coverage. And if you're from another payer, you also want to be having this coverage as you review their high cost claimants, and you're talking about all of the conditions that they're concerned about, the heart failure that needs heart transplant, the stroke, the kidney disease. You can remind them that this is all preventable. Literally a no-brainer. We've known about this since really the 60s, when and now 60 years later, we should be doing this for everyone.
So thanks, Maria. When I hear you saying there's a cuff in every household and people know how to use it and they're connected to care, and we have a sustainable system. So you and Aetna have put us well on that path, and we ask all National Forum members to find out what they can do to make sure everyone across the country who wants one and needs one has access to a cuff and is connected to care. Thanks so much, Maria.